Hey, this is Dr. Ankur Prakash from Living Well Balanced. Enjoy this amazing video by our all-star physician assistant, Joshua Corwin. He's got some amazing talents and expertise, and one of the things he's really passionate about is regeneration. And today's video is about hair regeneration, PRP for hair regeneration. Enjoy the video. To learn more about chiropractic care, the benefits of medical massage therapy and the IVs and everything natural that we do in our office, please make sure to subscribe to our YouTube channel and definitely click the bell. That way you'll be notified when we get our new video out.
Hi everybody, here today to talk about non-surgical hair restoration. It's no secret that hair loss is upsetting to men and women all throughout the world. There are some pretty excellent surgical techniques out there. Some of the downfalls are cost, pain, time of recovery, and success rates. For any of the previously mentioned reasons, surgical hair restoration might not be the best option for somebody. We are thrilled to offer non-surgical hair restoration here at Living Well Balanced. The proprietary technique that we use here at Living Well Balanced is different than anyone else that I've discussed who's performing hair restoration within the Triangle, and most likely even North Carolina. Many providers out there use PRP or Platelet Rich Plasma. PRP is a phenomenal technique to potentially regrow hair for patients. However, it's limited in the gains that can be achieved. PRP has some really wonderful applications, and it's one of the components that we use here, but it's a little bit more in depth than that. So the technique that we perform here uses local anesthesia in the form of a ring block. Using numbing agents, we numb the nerves just above the eye sockets here in the supraorbital region, and just in this range in what's called the preauricular region. And that performs a scalp block or a ring block to numb this entire portion of the scalp over here. In addition to using your body's own PRP, we add cholecalciferol, which is a liquefied water-soluble version of vitamin D, a vitamin mix, sometimes a low dose of a steroid to decrease some inflammation, as well as a wound micromatrix. The technique that we use here has been studied and researched and proven to be better than any other non-surgical approach to hair restoration. Our patients would choose to have this performed here for time efficiency, for lack of downtime. The technique that I perform here involves being treated on 3 different days. Each one of the sessions takes about an hour from start to finish, which includes the time for me to harvest and prepare PRP that we use. Once the solution is prepared, we inject it through all the areas of hair loss into the subdermal layer of the scalp, trying to create a small wheal or a small bump under the skin of the prepared solution. The goal of this is that we are providing all the nutrients and all of the growth factors that are required to regenerate hair. Our ideal candidate for hair growth is not someone who has full thickness baldness, who has lost their hair 15-20 years ago. This is not an approach to that, and that's somebody that we will humbly refer and defer to surgery as a potential fix. Our ideal candidate is someone who has mild to moderate hair thinning, who is in the process of losing hair, and we're trying to stop that from worsening and regrow hair. So many patients ask about the downtime and how long this takes. As I mentioned earlier, it takes about 1 hour from start to finish for each of the 3 treatments, each one a month apart. So we see you the first day, 1 month later, and 1 month after that. The overwhelming majority of people are seeing new hair growth by their 2nd or 3rd treatment. The benefits of our treatment can take upwards of a full year before we see the full potential. So this is not an overnight process. You're not going to wake up in the morning afterwards and see new hair and say, oh my goodness, look at this. This is a very different approach than a surgical intervention here. It's also a very different approach than some of the oral or topical medications in that there are no kidney side effects. There's no liver processing of any of the treatments here. This is all locally right in the scalp, and nothing that's going to have a long list of side effects or known complications like some of the medications out there on the market can. Simply, for patients that are having moderate hair loss and are looking for a really quick, efficient, and very low pain potential solution to regrow hair, we're here for you.
Thank you so much for watching our video. If you got a gem or 2 out of it, please make sure to like it and share it across your social media. If you haven't subscribed to our YouTube channel, please make sure you do that, and definitely hit the bell so that way you get alerted every time we get a new video release. Speaking of videos, we got 2 great videos right here.